Hi guys, my name's Alex. I'm really excited to be part of the Secret MENS Business TV. Thanks to Joey for asking me to contribute to this movement. I think it's really, really important. I'll be covering all things sex, so sexual health, sexuality, what I call sexual expression, which is an individual's way of expressing themselves sexually. So I'm really interested in kind of exploring what we do as men around sex, how we approach it, our attitudes towards it, very important things like sexual health, making sure that we're all looking after ourselves and each other. So I'm a Gestalt therapist based in Perth in Western Australia. I work for a not-for-profit organisation, so very busy as a therapist, but very interested in the field of sex because it's such a powerful thing and potentially hugely transformative for individuals as well. So earlier today, I interviewed Joe Stanislavski. He's the manager of the M Clinic here in Perth, which is a sexual health clinic for men who have sex with men. They can come and get tested, and everything's very confidential and highly, highly professional, very, very busy clinic. Joe is a full book on sexual health. So I thought I'd give him a call and see what he has to say about syphilis, because it's very important with the huge spike that we're seeing at the moment, that we know exactly what it is, how it affects us, how it can get treated, and what happens if we don't get treated. So thank you so much, Joe, for joining us.
No worries.
Really appreciate you setting aside some time. I know your time is really precious. I know how busy you are.
A little bit, yeah. But that's okay. I'll make time for you.
Fantastic. Thank you. So firstly, from your experience as a nurse, actually, do you want to say a little bit about who you are?
Yeah, sure. So my name is Joe Stanislavski. I'm a clinical nurse consultant, and I'm the manager at M Clinic, which is a sexual health clinic, a project of the WA AIDS Council that does HIV and STI testing and treatment and vaccinations for men who have sex with men, which is and as well as transgender and non-binary people too.
Fantastic. And whereabouts is that? Because this is an international show.
Oh, cool. Okay, so it's in Perth. It's in a sort of a character home on Newcastle Street in West Perth. Yeah, so in Western Australia, and we've been operating at full capacity post-COVID, and we were still operating even during COVID because we were classified as an essential service. So
Fantastic.
Capacity.
Fantastic. So can you describe really briefly what syphilis is?
Yeah, sure. So syphilis is a bacterial infection that can be transmitted through sex, can also be transmitted through skin-to-skin contact with infected lesions as well. And it is a bacterial infection that's systemic. So it starts out localized, whether it is a chancre, which I'll describe in later, as a chancre on your genitals or in your oral cavity, and then it becomes a systemic infection after a few weeks to a few months. It sort of becomes a widespread infection that sort of affects your neurological system more than anything else, and that's where we get things like neurosyphilis and tertiary syphilis. Mm-hmm. Yeah, it's a bacterial infection that's very easily treated with antibiotics.
Okay, so can you talk very briefly about what the treatment involves? Because I know
sure.
it's quite
So firstly, to have treatment, well, we're doing an initiative in Perth at the moment where if you are named a confirmed contact of syphilis, then you'll be offered preemptive treatment, but you'll still have serology done, which is just phlebotomy, blood taken from your vein in your arm. To have the syphilis treatment, it requires that you get a diagnosis for syphilis or that you're a confirmed contact. And a diagnosis is done through blood tests, in which we get after they get analyzed at a pathology company. So treatment for that is called benzathine benzyl penicillin. It's a 2-vial injection. So it's a white fluid with like the consistency of toothpaste, and we inject that intramuscularly. So that goes ideally into the buttock muscle, one on either side, with just long iron needles, just so that it can go into the muscular space and disperse that way. So some people find it quite painful, but if done right, it's not that painful.
Okay. Done by a professional like yourself.
Yeah. Well, one of the other more experienced nurses, but yeah.
Fantastic. Who are the people who should get tested? Who do you think?
Well, right now in Perth, it should be everyone. It should be part of your standard screening purely because we are experiencing a syphilis outbreak at the moment in the Perth metro area. So the Department of Health have identified priority populations with the syphilis outbreak being men who have sex with men, women of childbearing age, and especially pregnant women, so multiple testing throughout the duration of the pregnancy at first, second, and third trimester. Also, homeless people and Aboriginal people that live in the Perth metro area. So they're priority populations at the moment with the syphilis outbreak in Perth. But personally, I think everyone should get tested just because those populations intersect and, of course, infuse into other populations as well. There's no such thing as just one population being mutually exclusive from the other. So they're going to intersect, and it's very easily transmitted, even through oral sex, even with sex with condoms. Like, it's very easily transmitted if the chancre is on the outside of the sheath of the condom. So we suggest, at least to all of our clients, 3 to 6 monthly testing for syphilis, even if asymptomatic.
Fantastic. So,
I guess just to add to that, it's really important, I think, that GPs are upskilled and are aware that they should really ramp up their testing, and that it's at no cost to them to add on additional tests to a routine GP appointment that they might have with a patient.
Okay. So I'm really curious to ask you about why there's this. What do you think? I've got my own reasons, but theories. But what do you think is the reason for this spike in syphilis at the moment?
I mean, we saw the spike during COVID, so we saw that the highest numbers in the past 5 years presented in the month of May, and that was with all populations. It maybe lockdown sort of instigated things, or among other things. Like, it's interesting that we saw those high numbers, even though overall in the Perth metro area, testing rates reduced significantly. So there was a massive spike in the syphilis numbers, and also congenital syphilis. We know that the syphilis epidemic in Australia started out in Queensland area and has sort of worked its way up northeast Queensland, then to the Northern Territory, then to the Kimberley regions, now has reached the Goldfields area, and it's also and it has been in the Perth metro area for a while because we have mobile population. So it has been quite prevalent with the men who have sex with men population for the past 10 years, and that's why our clinic was set up to address that, and we have greatly. But of course, those populations intersect. And yeah, we're having increasingly mobile populations with, of course, like globalization and travel. So that's sort of aided in the transmission of syphilis too.
Okay. And to your knowledge, is this same thing happening in the rest of the world, or is this uniquely an Australian thing?
So, America is definitely getting hit with their own syphilis outbreak at the moment. I think it's a little bit worse than it is in Australia. And that's the only one that I'm very aware of, because they have very good like social media campaign around syphilis testing in America. I think Canada's also been hit with it as well. I think a lot of first world countries are getting hit with syphilis at the moment. Maybe not so the third world countries, purely because they're not aware of it there, and maybe the testing numbers are quite low, so they're not identifying it in the first place. But we're definitely seeing it in the first world countries now more than ever.
Okay.
So a number of these countries have launched their own public health campaigns to respond to that are quite unique. Yeah, and that's been happening for the past
fantastic.
10 years.
So we've got about a minute left. Is there anything else that you think is really important that men need to hear?
Yeah, well, I think it's important for men to understand that most men don't show any symptoms for syphilis. The primary symptom, which is a chancre, and if you look up chancre, it's like a flat disc with a little white middle, and that's full of the bacteria. That only presents in less than 50% of people with syphilis. So it's more than likely that you have it and you're not even aware of it. And it's also important to note that it does progress to neurosyphilis quite rapidly. We've seen people at the clinic who've had neurosyphilis after a potential only 6 months of sort of incubation period. So it can progress rapidly, and the side effects, the adverse events like visual disturbances and hearing loss, they are permanent. So even if you do have the treatment, they are not reversible. So it's really important to have regular syphilis testing if you are sexually active. Even if you've only had one other sexual partner apart from your regular partner in the past 12 months, it's good to have at least a syphilis test and asking your GP for it, and your GP should be able to do it. And if they don't, well, then find a different GP.
All right. Thank you so much, Joe. That's really informative. And hopefully we'll get the message out there and get the guys testing themselves more often.
Excellent. Thank you so much.
Appreciate it. See ya.
See you later. Bye.
So thanks again, Joe, for taking time out of your busy schedule. I know you're a very busy man. I also wanted to remind you guys to like and subscribe. I believe the like button is just about there. Hit subscribe and hit the little bell icon as well, so that you get notifications of new videos whenever they come up. And I know Joey, who's coordinating and putting all of this together, is very busy getting all sorts of really interesting information together. So whenever a new video comes up, if you've clicked the bell icon, you'll get instant notifications. I'm also really interested to hear any questions you guys have got around sex, sexuality, sexual health, sexual expression, and any subjects that you guys want me to touch on and explore. Please feel free to ask any questions and let me know what you want to hear about, because I've got some ideas about what I want to talk about, but I also want to really hear about what you guys want to hear about. So look forward to seeing you next time, and look after yourselves and look after each other. Thanks.